Good afternoon, I'm Madison Sears. This is my week 7 assignment for bipolar disorder. This is my overview. We're going to go over symptoms, origin, causes and triggers, methods of treatment, and examples. Symptoms, normally bipolar people have a major mood swings which range from manic ecstatic and depressive deep depression. In the manic ecstatic mood, it's normally like really random, large expenses, and abrasive and speaking really rapidly, and depressive is normally sleeping a lot and sometimes becoming suicidal. The origin of bipolar disorder is described by Hippocrates. In the earlier days, it was conceptualized by the end of the 19th century. Kraepelin, another psychiatrist, described it as a manic depressive insanity, which I believe would be fitting for people that are feeling this all the time. It must feel pretty terrible, which could be exhibited through single episodes of mania depression or many episodes of each. So there isn't like a pinpoint of this. A lot of studies are not exactly showing super supportive evidence because a lot of it varies from person to person. Causes and triggers. Causes, having a first-degree relative such as a parent or sibling with bipolar disorder. You can go through crazy traumatic events that could cause this, and also drug or alcohol abuse. Methods of treatment. So there's behavioral therapy, which is going to focus on stress to decrease that stress and change how the person reacts to those certain situations. And then cognitive therapy is going to more focus on changing the perspective of that situation. Cognitive behavioral therapy, which is a mixture of both, which I kind of alluded to in the last slide, is what fits best for this diagnosis that I've seen through research. The three parts of that is assessment, psychoeducation, and methods of mood episodes or preventing reoccurrences. So assessment is going to be making that diagnosis and using a symptom chart to really figure out what the degree is of this mental disorder that this person has. And then psychoeducation is going to be really filling in like how they can better their environment and their physiological reactions and behavior. A lot of the education is going to be the biggest chunk of this CBT portion. And then methods for mood episodes and preventing reoccurrences is going to be interventions like snapping out of it, and then when relapses occur, how to go in from that. This was just a funny little thing. Examples of this include Mel Gibson, Demi Lovato, and my mother. Mel Gibson, Demi. Works cited. This is just my works cited page. And